Okay, so today we're looking into something pretty interesting, I think. This link between autism and alcoholism kind of caught me off guard when I first saw this article. It's from Cheap ABA. It's called Autism and Alcoholism: The Hidden Connection.
Yeah,
Yeah.
I could see how that would be kind of a surprising connection.
Yeah, you don't hear about it a lot, but as I started reading it, I realized it's something we should really look into. I think it's worth the deep dive.
It's definitely something that
Yeah.
we need to be more aware of.
Yeah, and I think so for this deep dive, we should unpack why this connection exists in the first place and then explore,
Yeah.
what we can do about it. And I got to warn you, this article starts out with some pretty hard-hitting stats. Did you know that individuals with autism are 2 to 3 times more likely to develop an alcohol use disorder?
Wow. Yeah. That's that's pretty striking.
Yeah, and 1 in 5 individuals with autism will face some kind of substance use disorder, and alcohol is the most common.
It's
Yeah.
it really underscores the importance of understanding this connection.
Absolutely. So let's get into the why. The article points to a few key factors. The first one that really stood out to me was the social difficulties that many individuals with autism experience. And it's not just about being shy, right? It's about struggling with those nuances of social interaction.
Right. It could be really challenging.
Yeah, like imagine trying to navigate a world where sarcasm just flies over your head
Yeah.
or constantly misinterpreting those nonverbal cues. It's gotta be.
It can be incredibly isolating and
Really?
overwhelming. And, for some people, that feeling of being out of sync socially is so intense that it can lead to using alcohol to numb those feelings, even if it's just temporary.
Right. It makes you wonder if we created a society that was more inclusive and understanding, would it take some of that pressure off? But I don't want to get ahead of myself. The article also talks about sensory challenges,
Hmm.
which I have to admit I didn't really get the full impact of until I read some of the personal stories in the article.
Right. Yeah. Sensitivities are a big part of the autism experience for
Yeah.
many. It's not just about disliking certain sounds or textures. It's about experiencing the world with this heightened intensity that can be completely overwhelming.
Wow.
Like imagine feeling constantly bombarded with sensory input, bright lights, loud noises, even the feeling of clothes.
Yeah.
It can be unbearable.
Wow. Yeah. That really paints a whole new picture for me. It's no wonder then that some people might turn to alcohol as a way to try and turn down the volume on a world that feels way too loud. Like using a sledgehammer to quiet a jackhammer, you might get that temporary relief, but at a huge cost.
Exactly. It's a short-sighted solution. That can turn into a much bigger problem really quickly.
Yeah, for sure. And then there's the mental health aspect. We know that individuals with autism are statistically more likely to experience things like anxiety and depression.
And fortunately, those conditions
Hmm.
can increase the risk of turning to alcohol
Yeah.
as a way to self-medicate,
Uh,
to try and numb those difficult emotions.
yeah, it's like this vicious cycle, right?
Yeah.
The things that might make someone more vulnerable to alcohol use are also the things that alcohol can make worse. It's
Yeah.
kind of a double-edged sword. So I'm curious, what does this article say about solutions? Is there hope here?
Oh, absolutely. There's definitely hope. The article really highlights the power of early intervention as a crucial factor in helping individuals with autism develop those skills and coping mechanisms they need to thrive.
Okay, let's talk about that. Early intervention. What does that actually look like in practice?
Well, it can involve a range of therapies and supports,
Hmm.
tailored to each individual's needs. Think about things like applied behavior analysis, ABA, which can help develop social skills, or sensory integration therapy, which addresses those sensory sensitivities. Providing these targeted approaches can really equip individuals with the tools they need to navigate the world in a way that feels less overwhelming.
So it's not just a one-size-fits-all approach. It's about finding the right tools for
Mhm.
each person.
Exactly, exactly. And another key element is mental health support. Having access to things like therapy and counseling can equip individuals with those healthy coping mechanisms for anxiety and depression
Yeah.
and, other challenges, which can help reduce that reliance on alcohol.
So we're talking about giving them a whole toolkit for mental and emotional resilience, giving them the support they need to face those challenges head on, instead of turning to substances like alcohol.
Precisely. And it's not just about individual interventions. It's also about creating a more inclusive and supportive society as a whole. Imagine a world where sensory-friendly spaces are the norm, where workplaces are more understanding of neurodiversity, where social skills training is readily available.
Okay, now we're talking. That sounds like a pretty amazing world. But how do we even begin to create that? It feels kind of like a huge undertaking.
It can seem daunting, but even small steps can make a difference. It starts with awareness, challenging those misconceptions and stereotypes about autism, advocating for policies that promote inclusivity and support.
So just by having this conversation, by raising awareness, starting to think differently, we're already taking a step in the right direction.
Absolutely. Every conversation, every effort to educate, it contributes to positive change.
I like that. Makes me feel like we can all play a part in building this more inclusive world. So, we've covered a lot of ground here, but I have a feeling this is just the tip of the iceberg.
You're right, there's so much more to unpack.
Yeah, there's so much more to unpack.
And that's what we'll be doing. In the next part of our deep dive, we'll be delving deeper into the specific challenges and solutions surrounding autism and alcohol use, exploring those resources available, and looking at how we can all contribute to creating a more supportive and understanding world.
I can't wait to continue this conversation. We'll be back soon with part 2, where we'll explore those solutions in more detail. Welcome back to our deep dive into autism and alcoholism. In the last part, we talked about some pretty alarming statistics and some of the reasons behind this connection. We touched on things like social difficulties, sensory challenges, and mental health concerns, all things that can make folks with autism more vulnerable to alcohol use.
Right. And we started to explore the idea of early intervention and mental health support, key pieces of the puzzle.
Right, exactly. So for this part, let's dig a little deeper into some of those specific challenges, Before reading this article, I don't think I really grasped how profound of an impact sensory sensitivities can have on someone with autism.
Yeah. Definitely often misunderstood.
Yeah.
Imagine walking into a grocery store. For most people, it's just another errand. But for someone with those heightened sensory sensitivities, it can be a complete assault on the senses. Fluorescent lights buzzing, the cacophony of shopping carts, the overwhelming smells from the bakery and the deli. It's like their senses are in overdrive, and it can be incredibly distressing.
Wow, yeah. I can see why the article describes it as living in a world that feels way too loud.
Right.
So knowing that, it's not surprising that someone might turn to alcohol to try and numb those feelings.
Exactly. Alcohol can temporarily dull those senses, make the world feel a little less intense. But it's only a Band-Aid. It doesn't address the root cause.
Right. And as we said before, it comes with all those risks and potential consequences, including addiction. So if alcohol is not the answer, what are some healthier ways for individuals with autism to manage those sensory challenges?
Well, there are actually a lot of great strategies out there. Things like occupational therapy can be really effective. It focuses on helping people develop coping mechanisms for those kinds of overwhelming situations.
Yeah.
So, for example, they might learn techniques for self-regulation, like deep breathing, or using weighted blankets to provide that sense of calm.
Oh, interesting. So it's about giving them the tools to manage their sensory input.
Exactly. And, creating those sensory-friendly environments can make a huge difference as well.
What do you mean?
Think about things like spaces with dimmed lighting, quiet areas where people can retreat if they're feeling overwhelmed, maybe even noise-canceling headphones.
Yeah.
These little adjustments can go a long way.
That makes sense. So it's about creating spaces where folks with autism can feel comfortable and in control.
Exactly.
Okay, so we've talked about sensory challenges. The article also highlights social difficulties as a big factor, contributing to alcohol use. Can you unpack that a bit more?
Sure. For a lot of individuals with autism, social interaction can be incredibly challenging. And again, it's not just about being shy or introverted. It's about struggling to decipher those unspoken rules of social engagement.
Yeah, I get that.
Imagine trying to interpret sarcasm or understand body language or navigate a group conversation. It can be really difficult.
It's like trying to learn a whole new language where the rules aren't always clear.
That's a great analogy.
Yeah.
And, that feeling of being out of sync can lead to feelings of isolation, loneliness, anxiety, and for some, alcohol might seem like a way to loosen up, to try and fit in, maybe quiet those anxieties.
Right.
But as we've been saying, it's a slippery slope.
Yeah, it is. So how do we help people with autism build those social skills and feel more confident in social situations?
There are some great programs out there. Social skills training can be really helpful. Think of it like learning a new sport or a musical instrument. It takes practice, guidance, and the right tools. These programs teach practical strategies for understanding social cues, navigating conversations, building relationships.
So it's about breaking down those complex interactions into smaller steps.
Exactly. It's about giving them a roadmap.
Makes sense.
One approach that has shown a lot of promise is video modeling.
Oh, yeah, I've heard of that.
So people watch videos of others interacting in social situations,
Mm.
and then they get to practice those skills themselves in a safe environment.
So it's like having a social skills coach.
Exactly.
That's cool. Are there other resources that can be helpful?
Yeah, support groups,
Mhm.
specifically for individuals with autism, can be really valuable.
How about
They
that?
provide that space to connect with people who understand,
Yeah.
share their challenges,
Yeah.
practice those social skills.
It's about creating that sense of community.
Exactly, finding your tribe,
Yeah.
which can be incredibly powerful.
I agree. Okay, so we've talked about sensory challenges, social difficulties, but I want to circle back to something you mentioned before, mental health support. We know individuals with autism are more likely to experience things like anxiety and depression. And we've talked about how that can increase the risk of alcohol use. So what are some effective ways to address those concerns?
Mental health support is essential, and it's important to remember, individuals with autism might experience and express their emotions differently. So finding a therapist who understands autism and those specific challenges is really crucial.
So someone who can kind of speak their language.
Exactly, someone who can meet them where they are.
Okay.
Therapy can help. Develop those healthy coping mechanisms for managing stress, anxiety, and difficult emotions. Reducing that urge to turn to alcohol.
Right, so it's about empowering them to
Yep.
take control of their mental health.
Exactly. And there are a variety of approaches that can be effective. Cognitive behavioral therapy, CBT, can help people identify and challenge those negative thought patterns. Mindfulness-based therapies can teach techniques for being present in the moment and managing overwhelming emotions.
Again, it's about finding the right tools and techniques.
Exactly, creating a personalized plan.
Okay,
Medication can also play a role when appropriate.
that makes sense. So we've talked about sensory challenges, social difficulties, and mental health support. Are there any other challenges that come to mind? Things that might be unique to this population?
That's a great question. One challenge that often comes up is the potential for misdiagnosis or delayed diagnosis of alcohol use disorder in individuals with autism.
Oh, interesting. How come?
Well, some of the signs and symptoms
Mm.
of alcohol use disorder, like changes in mood, behavior, difficulty with social interaction,
Okay.
can overlap with
Mm.
or be mistaken for autistic traits.
Oh, wow. Okay, so it's like trying to untangle a knot where all the strands look similar.
Exactly.
Yeah.
So that's why it's really important for healthcare professionals to be aware of this overlap
Mm.
and to conduct those thorough assessments,
Makes sense.
looking at the person's full history, including their autism diagnosis,
Mm.
and ruling out other potential causes.
Yeah, early detection is key.
Absolutely.
Okay, so misdiagnosis is something to be mindful of. Any other challenges?
Another important consideration is the potential for negative interactions between alcohol and medications that are often prescribed for autism. Some medications used to treat anxiety, depression, or behavioral challenges can have really bad effects when combined with alcohol.
Okay, so that's definitely something that individuals with autism and their families need to be aware of. Talk to their doctor about.
Absolutely. Open communication is key.
Yeah. This has been really eye-opening. I feel like we're really starting to peel back the layers of this complex issue and gaining a deeper understanding of the challenges. But I also feel like we're uncovering a lot of potential solutions, a lot of reasons to be hopeful.
I agree. It's about shifting our perspective from seeing autism as a limitation to recognizing the unique strengths and abilities that individuals with autism bring to the table. It's about creating a world where they can thrive.
I love that. And that brings us to the final part of our deep dive, where we'll explore those solutions in more detail. We'll be talking about specific strategies, resources, and ways that we can all contribute to creating a more inclusive and supportive world. Stay tuned.
Welcome back to the deep dive. We've been exploring this complicated connection between autism and alcoholism. And I got to say, this deep dive has been really eye-opening and inspiring both. You know, we've talked about the challenges, the sensory stuff, the social difficulties, the mental health factors. But now I'm really curious to get into the solutions. Like, what can we actually do to make a difference in the lives of people with autism and help prevent these alcohol use disorders?
Well, that's the big question, right? And the good news is there are a lot of answers. It's really a multifaceted approach, but it starts with understanding that early intervention can really be a game changer. Okay, I think we keep hearing early intervention, but what does that actually look like? What are we talking about?
It's kind of like building a solid foundation for a house. The earlier we can identify autism and provide the right support, the stronger that foundation is going to be. It's all about giving individuals the tools they need to navigate the world
Yeah.
and make it feel less overwhelming.
So we're not just waiting for problems to pop up, we're being proactive.
Exactly.
Okay, so what kind of tools are we talking about here?
Well, there's a whole range of therapies and interventions that can be really effective. We've touched on some already. Things like applied behavior analysis, ABA, sensory integration therapy, speech therapy. These are all targeted approaches
Mm.
that address the specific challenges and help individuals develop the skills they need.
And we talked about how social skills training can be a game changer for navigating social interaction.
Absolutely.
Yeah.
Imagine a young person with autism struggling to understand, sarcasm or nonverbal cues. Social skills training can give them the tools to decode those mysteries, to understand those unspoken rules, and to feel more confident interacting with others.
It's like a secret decoder ring
Yeah.
for social success. Are there any techniques or programs that stand out as particularly effective?
Yeah, there are a few. One that's become really popular is called social stories.
Okay.
It involves creating short stories, often with visuals, that describe specific social situations, and they provide clear guidelines for behavior.
So breaking it down into smaller, more manageable steps.
Right.
That makes a lot of sense, especially for those who might struggle with abstract concepts or unexpected changes.
Exactly. And another approach that's becoming increasingly popular is video modeling.
Yeah, I've heard of that.
It's based on the idea that learning by watching can be super powerful. So individuals watch videos
Mm-hmm.
of people interacting in different situations, and then they have the chance to practice those skills.
In a safe environment. It's like having a social skills coach right there in your pocket.
Exactly.
That's amazing. And of course, we can't forget about mental health support.
Absolutely. It's essential. We know that folks with autism are statistically more likely to experience things like anxiety and depression,
Mm.
which can really increase the risk of turning to alcohol to cope.
So it's not just about preventing alcohol use, it's about giving them the support to manage their overall mental health.
Exactly.
Oh.
And there are some effective approaches that can help. Cognitive behavioral therapy, CBT,
Yeah.
teaches people how to identify and challenge negative thoughts.
Yeah.
That contribute to anxiety and depression. And then there's mindfulness-based therapies,
Sure.
which can help them learn to be present
Yeah.
and manage those overwhelming emotions.
So we're giving them a toolbox filled with different strategies
Right.
and finding the right therapist, someone who really understands autism.
Exactly. Someone who can meet their needs.
Makes sense. So we've been focusing on these professional interventions, but what about families and communities? What role can they play?
Oh, they play a huge role. I think one of the most powerful things is creating that loving and supportive environment.
So letting them know they're accepted for who they are.
Exactly. It's about celebrating their strengths and providing that safe space for them to express themselves and ask for help when they need it.
That's so important. Are there any practical tips that families can use to address, those underlying vulnerabilities, the sensory sensitivities, the social difficulty?
Absolutely. For sensory challenges,
Good.
families can work with therapists to develop strategies, creating quiet spaces at home, using noise-canceling headphones, providing calming sensory toys or activities. These can all make a difference.
It's about making the world a little more autism-friendly
Exactly.
and for social difficulties.
Families can encourage participation in social activities and support groups that are designed for folks with autism. These provide opportunities to practice those skills in a safe space, to build friendships and connections.
To find their people. So as we wrap up this deep dive, I want to shift gears a bit. We've been focusing a lot on the vulnerabilities, the challenges, but what about the strengths? What about the unique talents that people with autism bring to the table?
That's such an important point. Autism is not a deficit. It's a different way of experiencing the world, and it comes with its own strengths and gifts.
So let's talk about those strengths.
Often, they have exceptional attention to detail, this remarkable ability to focus, a unique way of thinking outside the box. They can be incredibly creative and innovative, passionate about their interests.
So it's about recognizing and celebrating those abilities.
Exactly. It's about embracing neurodiversity and understanding that different doesn't mean deficient. Individuals with autism have so much to offer.
I love that. It's a reminder that we need to shift our perspective and see autism as a valuable part of the human experience.
Exactly. It's about creating a world where everyone feels seen, heard, and valued.
This deep dive has been so informative and inspiring. We explored the challenges, the solutions, and I think what we've really uncovered is a message of hope. By understanding autism, by addressing those underlying vulnerabilities, by creating a more inclusive world, we can empower individuals with autism to live amazing lives. Thank you for joining us on this journey,